This patient was referred to me for apicoectomy of tooth number 8. According to the patient, the root canal was done about 10 years ago. Patient states for months he's been getting a bubble, he called it a bubble, above the tooth on his gum that he pops himself, or sometimes the bubble pops on its own. So he finally went and saw his dentist and was referred to me for apicoectomy. And you can see why. There is no way that this gigantic cast post core crown could be removed. And patient actually likes the crown. Patient has no issues with it. So we can just go ahead and take care of that periapical relucency there, that infection there, by doing an apico. So let me show you the sinus tract on the labial of tooth number 8 as well. And here it is, as you can see right here, and that's the tooth number 8. You can see tooth is kind of elongated as well. Look at tooth number 9 in comparison. But patient is okay with that. Patient has no issues with the aesthetic of the tooth. But as you can see, there is an active, and this was an active sinus tract, so meaning that if I milked it, pus would come out. So we talked about options. Apico with decent prognosis, not great prognosis, but good prognosis, versus extraction. Patient said that he wanted to go ahead with the apico, and that's what we did today. This is the apical few millimeters of the root of the tooth that we removed, and you can literally see the gutta-percha sticking out. Look right there. That's gutta-percha. But that's what we removed. So we cut the apical few millimeters, and then we went ahead and used the surgical spoon and just cleaned out the granulomatous tissue from the apical area, retro prepped, and then retro filled with white MTA. If I zoom out, you can see the difference. That's pre-apico and this is post-apico. Everything went great. I have a couple of apicoectomy treatment, surgery, apicoectomy, surgical videos that you can watch from start to finish how I do it, and I've posted them here on TikTok and also on my Instagram and YouTube page. You can go ahead and watch those if you're interested. But as you can see, everything went great. That's post apico, pre-apico, post apico. Everything went beautifully, and we stitch everything up, and we'll see patient in a few days for post-op check and suture.